Parsvottanasana, intense side stretch pose. This advanced pose is challenging, mainly because it includes components requiring high motor control for organizing the body limbs in space. There are a number of possible hand positions, and exercisers can choose their favorite variations for their personal training. Performance. We begin in a stance with our feet parallel, Tadasana. Then we take a large step forward with the left leg. We rotate the right rear foot to an angle of 45 degrees. The hands are in a reverse prayer pose, palm to palm behind the back. We bend the upper body forward so that it faces the left leg. Bend the spine forward. This asana stretches the posterior chain muscles in the leg and back. In the leg, the main muscles stretched are the gluteus maximus, hamstrings, gastrocnemius, and soleus. The erector spinae are stretched in the back, and the trapezius assists in scapular retraction. In the shoulder joint, the infraspinatus and anterior deltoid are stretched. This asana also stretches the wrist flexor muscles. Common problem number 1, range of movement of the shoulder and wrist joints is limited. Solution: A. Interlace the fingers, keeping elbows straight. B. Place hands on the lower back, hand on hand, which will result in the scapulae coming closer together. C. Straighten the arms forward on both sides of the foot. Common problem number 2, when the hamstrings are short, the range of hip movement is limited. Shortened hamstrings limit range of movement and cause a greater load on the lower back because of the larger movement lever. In this situation, the upper back tends to become rounded at the expense of hip flexion. Kinesiologically, the body tends to take movement to where it feels most comfortable, and in this case, to circumvent the hip joint limitation, the movement is transferred to the spine. In this way, exercisers work around the point of difficulty and take the movement to where it feels more comfortable. As a result, the integrative flexion movement, which is supposed to be distributed throughout the body, focuses only on one specific area, back flexion, with no movement created in another area. In order to improve the quality of pose performance over time, it may be necessary to use an adaptation so as to improve focus and isolate areas that limit movement, isolating stretch. The solution is to use cubes for supporting the hands while maintaining an elongated back position. Common problem number 3, back pains from overload during forward flexion. Solution: A. Support the hands on cubes and perform the pose with an elongated straight back. The height of cube support is determined by the exerciser's ability. Anterior pelvic tilt should be maintained with slight lumbar lordosis. This position emphasizes forward flexion from the hip joints and not, as from back flexion, isolated flexion of the hamstrings. B. Support the hands on a chair and maintain an elongated back parallel to the floor. C. Lean hands and forehead on a wall. Common problem number 4, when overload is created on the knee of the forward leg. The pose exerts a heavy load on the forward leg, and this load increases when hamstring flexibility is limited. Good hamstring flexibility significantly reduces the load exerted on the forward knee. Solution: perform the pose with the knee of the forward leg slightly bent. Common problem number 5, hyperextension of the knee. Where the knees are hyperextended, performing the pose in a straight leg variation may cause great load on the forward aspect of the tibia, and in many cases may cause damage to the knee. Solution: perform the pose with forward leg slightly bent.